One of the things we recognize as behavior analysts is the diagnostic tools that we use aren't functionally based. They are based upon topography of behavior. So you have to keep in mind that component. However, there doesn't mean there's not any use in understanding how there can be a cluster of behaviors that form a diagnosis, despite the fact that it's not functionally aligned. I do want to mention that there are two main diagnostic classification systems that you may have heard of. The Diagnostic Statistic Manual 5, that's usually used by psychologists in the United States, make the primary tool that individuals will diagnose from here. But there's also ICD that went to the 11th version. And ICD, it's oftentimes used by more medical professionals and even some clinicians in other countries. Disagreement, or there's not consistency between the two, because the Diagnostic Statistic Manual does not recognize two different diagnoses of PTSD and complex PTSD. So they don't distinguish those two as separate diagnoses, but the ICD-11 does. So I think there are some similarities